when they asked his name, he refused to answer. The hospital journalist reported about the mysterious patient who arrived without identification or personal information. His sudden appearance at the emergency room created puzzles for medical staff trying to provide care. Hospital security posted an advertisement seeking information about the unidentified patient's family or background details. His consistent refusal to provide personal information frustrated staff who needed medical history for treatment. Staff originally suspected amnesia, but his selective silence suggested deliberate withholding of personal identification information. Setting legal concerns aside, medical staff focused on providing emergency care, despite the patient's mysterious circumstances. Nurses provided comfort to the frightened patient while respecting his right to privacy and anonymity. Secondly, his refusal to communicate created challenges for understanding his medical needs and treatment preferences. The patient suffered severe injuries that required immediate surgery regardless of his identity or background. Without family history, doctors could not assess gene-related health risks that might affect treatment decisions. The prospect of treating someone without medical history worried doctors about potential complications and allergic reactions. Outside, snow fell quietly while inside. Medical staff worked to save an anonymous patient's life. Some staff suspected a criminal plot behind his refusal to reveal identity, but medical ethics required treatment. Visible bruising around his neck suggested possible assault, making his silence more understandable for staff. Standard admission criteria require patient identification, but emergency medical ethics override administrative requirements completely. Medical staff primarily concern themselves with saving his life rather than solving the mystery of identity. Doctors had to integrate treatment plans without knowing previous medical conditions or current medications the patient used. Despite criticism from administration, medical staff continued providing excellent care to the mysterious patient regardless. Medical convention demands treating all patients equally, whether they provide identification or remain completely anonymous. I would bet that his silence protects someone else rather than hiding criminal activity from authorities. The patient retained his right to privacy, even while receiving life-saving emergency medical treatment. The sequence of his injuries suggested a pattern consistent with domestic violence, rather than accidental trauma. It was plain to see that fear, not defiance, motivated his refusal to provide identification. A social worker volunteer spent hours building trust with the patient to understand his situation. His clothing suggested rural origins, but this provided little help in establishing his actual identity. Medical staff maintained calm professionalism, despite frustration about the patient's mysterious circumstances, and continued silence. Ethical medical practice never abandons patients regardless of their cooperation with administrative requirements or legal obligations. Physical examination revealed healed scars suggesting a history of violence that explained his reluctance. His protective silence gradually gave way to whispered thanks, as medical staff demonstrated genuine care. Trust developed rapidly once the patient realized that medical staff prioritized his welfare over bureaucratic requirements. Efficient emergency treatment proceeded despite administrative complications caused by the patient's anonymity and silence. This case sparked a revolution in hospital policies regarding treatment of patients who refuse identification. Staff felt delight when the patient finally smiled, indicating trust in their commitment to his care. The patient's spell of silence broke when he whispered gratitude for the compassionate medical care. The premise that all patients deserve care regardless of identity guides ethical medical practice. The patient began to lean on medical staff emotionally as physical healing progressed steadily. His dramatic recovery included not only physical healing, but also restored faith in human kindness. Medical ethics differ from legal requirements, prioritizing patient welfare over administrative compliance and identification. Eventually, the patient became grateful enough to share his story of escaping domestic violence.